And welcome into To Your Health. You know, it seems that we age. Two words kind of give us a little bit of fear in our life. One of them would be dementia, the other Alzheimer's. So we're going to take a look at both of these today. And our guest is Dr. Tom Geary. And Dr. Geary, you are with the Alabama Department of Public Health.
That's correct.
I know your department kind of oversees the inspection of facilities in the state.
That's right, licensed healthcare facilities.
That's right. But you also, you know, you've got a special flair for looking at and trying to help people in the area of Alzheimer's. First of all, we talked about two different things because sometimes they can become confusing.
Yes.
And because I heard about a guy in his 90s, they said recently, well, they've diagnosed him with Alzheimer's. I said, well, that's usually at 90, it's normally probably dementia. Is that not right, or is that a myth?
Well, Alzheimer's is one of the types of dementia.
Okay.
But as we all get older, we have more and more difficulty making complicated decisions. For example, buying and selling properties and executing wills and things. And that's a normal component of aging, and it is a form of dementia that interferes with people making good decisions, and that's why there's so much exploitation of the elderly.
Yes.
These scams of the telephones and prizes and things like that, because people tend to lose that ability to make good decisions. But Alzheimer's is not a normal part of aging, and there are about 100 other types of dementing illnesses that have been identified. And a careful neurologic evaluation can sort these out into different types, and there have been developed specific blood tests and brain tests, scans and things that can categorize people in different types of categories of dementia. And the most common are the vascular dementia, which is losing blood supply to the brains and having the cells die, the Alzheimer's type of dementia, and one called Lewy body dementia that's a lot like Parkinson's disease and may overlap with Parkinson's because there is a dementia associated with many, but not everyone, with Parkinson's disease. And then there's some less common things. We all know that mad cow's disease and other viral illnesses can cause a dementia-like illness as people decline overall. But the main dementias that we deal with in this country are the Alzheimer's, the vascular dementia, the Lewy body dementia, and one called frontal temporal dementia. So those are the big four types of dementia. There are a lot of things that people can do to prevent or at least postpone the onset of dementia. So the main thing is to keep your brain as strong and healthy as possible. That means don't smoke. Maintain excellent blood pressure control, excellent diabetic control, and like you just said, exercise, regular physical exercise, and then regular mental exercise, keeping your mind engaged and active. Those things can see people through 10 or more years of a normal life at home, being able to function normally, even if there is an underlying disease that is gradually creeping up on you and beginning to destroy some brain cells. If you have an abundance of good, healthy, functioning cells, then the effects of, say, Alzheimer's can be postponed, we know, for 10 years, the onset. In people who have long-standing diabetes and hypertension, a little bit of Alzheimer's puts them over the edge. They can no longer care for themselves and maintain their integrity as a person by themselves. They need more and more assistance to do things.
How does one know when it's simply the aging process? Like, all of us have a, like, I don't remember names as easily as I used to.
Talks about having a senior moment.
You know, and you'll say, whoops.
I do too. Yes.
How do you know when there's a difference in just the normal process of aging and when you cross over into dementia or Alzheimer's?
All of these dementing illnesses are illnesses that actually begin to affect people's everyday life.
Okay.
So it's not just forgetting someone's name and then recalling it, or not knowing where you put your wallet and your keys when you came in, or why you walked into the kitchen,
Right.
after supper. What was I looking for? It's when this actually begins to interfere with people's lives. So they are, the earliest thing is this loss of what's called executive function, the higher functions of making decisions. So if decision making is becoming more and more of a problem, and people are making bad decisions, that's a clue. And then forgetting things that have to do with our normal daily life, like where the bathroom is in the house, where we live.
Thank you, Tom. It was
You're
very
welcome.
interesting, very
Thank you.
good information also. And just remember, as Dr. Geary said, one of the main things you can do is keep this mind as active as you
That's
can. It may be puzzles, it may be still working. Do something, but don't just stop using your mind. We'll be right back right after this.